Good morning. I am so glad you're here. Solstice is coming. I hope that you have been doing a lot of good things to wrap up processes from the fall before we go into a hibernation time. And DeAnna's here to answer any questions that you have today. So take it away.
Oh, hello everyone. And yeah, Andrea's right. We're in the last little stretch here of autumn follow through. The leaves fall off the tree, everything goes into a colder, more inert space. We're preparing for winter. It makes the veil thin. And so it's just really this beautiful time to consider what needs just a little tweaking and what do you want to do to follow through, make that last little change in a form that needs to just get completed. So, what is right on the edge? Not everything that you decide you wanted to complete for the year. Oh my gosh, it just doesn't happen, especially this year. But what are those pieces, that you're sitting on and just button them up and take this weekend to think about that. I know I'm doing that. And then we can go into hibernation. And hibernation doesn't mean you're not going to do anything. It more it more puts you in a state of wondering, thinking big and wondering, and like sitting with your own self, sitting in the privacy of your home or sitting in your thoughts and being able to really go inward and I'll elaborate on that actually, and then we'll see our questions. But if I was going to elaborate on the starting of winter, like right now, follow through for the next week. But the next step is going to be, well, what do you do then? And this is the time of year where it's so nice to get just crazy on your dreams. Take a moment to think huge. I want this, and I want this, and I want this, and I want this. Like, really let yourself go. Don't think about money or can you do it or not. Just really go with it. And I say take a good 10 days into winter to just yah. Now, I'll give you a little more advice, but what I really want to say is anytime I'm working on anything, which to be honest is year round, there's at least an hour to an hour and a half every single day that is actually needed to make that thing happen. If you really want to make it happen. And I'm talking a brand new project. You're going to have less time, but as soon as you're doing something, the ball's rolling on one project, guess what? There's going to be another project. And so you're still going to get that, how do I get an hour, and really I want to tell you an hour and a half in my life every day to actualize a dream? So your first step is to, hey, can you do that at night, or can you do that in the morning, or can you do that? Do you have more, grace during the middle of the day? What's your timeline for that time? Maybe a little bit in the morning, a little bit at night. I find it's better to just dive in. And I think if you just let your yah-yahs go out and think really big, you then could take another 10 to 20 days, to be honest, and you could really start looking at that list. Like, what is so grandiose, there is no way it's going to happen? Because I get a lot of those. And then which ones are maybe even an add-on to what I already have? So it might be the ball's already rolling. I just want to get a deeper roll, or I want to get more money out of it, or get more reward. And I still have to then be like, wow, that's one of my projects for the year. So what I suggest is you either have one brand new huge, you're reinventing yourself. Well, guess what? That's one huge project that's going to have easy 4 to 7 avenues that you're going to have to run to actualize it. So big project one, and you really can do this. But if you already have kind of my work, or you have a relationship and you're trying to build something else, or even in your health, because that's a project, I say 4 projects a year that are beyond your primary projects of life are just about all we can really handle. And sometimes I can only have my primary project, which is my work life, and then I can take on one other big project. But I'll tell you what, I could go with every dream that comes through my space. I can go with every creative vision that I can come up with, and I'm not going to actualize any of it if it just is a conversation and a dream and I'm just thinking big. So I have to really say, do I want to finish something this year, or do I want to keep talking year to year and keep having these dreams, but they don't actualize? So there's the steps that have to be taken. And so, first off, the big dream. Then I'm going to mark off that list and I'm going to come down to either one primary big project or 3 projects I can handle in the year. And now you're 30 days in. You took 10 days to yah and just dream big. You took another 20 days to start really thinking and looking for universal signs. Like, I want a couple days or 10, 20 days when I get down to my list to say, okay, universe, now show me. Like, give me some signs. I like signs in 3s, but I'm like, give me some signs and let me see if I can, get that yes from elements from the universe and be able to be like, yeah, there it is. Or someone calls and says, I have this brilliant idea, and it's the same idea. And guess what? I could be competitive, but no, that's not going to get you anywhere. You have to be like, oh, we have the same idea. Guess what? Big dreams take more than one person. So the moment somebody has the same dream, that's when it's really important to collaborate and to think about how are we going to do it together so that this really gets actualized. So you have to look for the signs, and you have to not go into the triggers. Because sometimes the signs will even bring on a like, oh, my baby, it was my idea. It's like, wait a minute, that idea is not going to get done alone. So you should be glad other people are having the same idea. It means you're onto something. But it also means there's steps. Now, winter is 3 months long, and I just gave you a 30-day plan. So I obviously have launched into my lovely little talk with us all right now. And the next 30 days is the hardest 30 days ever. So January into February is challenging in a project, and I'll tell you why. Because the only way you're going to actualize a dream, and you can't go talking it and spouting it and starting meetings with everybody and taking action yet. You're in hibernation winter. This belongs to you. You're inward. You're planning. You're organizing. That's the beauty of Vata Cold. They're amazing planners and organizers. And you have to be willing to go in the cold and use that time. And this is the hard part. It's called a budget. I'm not kidding. Yeah. Finances are so hard for people, and they're hard for me too, and maybe they're not quite as hard for me, just because, my mom was an accountant for the city of San Jose for 28 years. And so, I think about that and I'm like, okay, numbers, bringing in, taking out, that kind of works for my Aquarian and my number self. But, tracking money, it's not my thing. I don't really love it. And some people do. So who's going to help you in these finances and budget? Or are you going to just start, like I did, digging in and starting to say, hey, I'm sure there's things online that'll teach me how to create a budget. I bet I have a program right on my computer that teaches me how to spreadsheet and develop a budget. But it's very, very important, because then you'll see your obstacles and how much money is in the way needed and is maybe in your way and an obstacle. And then you can start taking the next 30 days to get, again, creative.
Right.
But you got to be creative with your money. You got to be creative with the budget, with the project, and what is that going to cost? Our health costs money. Changing our career costs money. Learning new things costs money. Wanting to travel costs money. New relationships cost money.
Yeah.
And if you want to keep your relationship alive, guess what? That costs money.
Right.
And then if you're planning a family, it costs money. So I'm not trying to stress you out in a stressful time. I'm actually trying to be realistic about you can do it and you can face those numbers and that budget. And if you really want to change what was into something new, well, this is the time to do it. It's the time to plan, keep it to yourself, organize it, and get it really solid in how this is going to work. And then you'll even know, do I need an investor? You know, would the loan be worth it? Would the return come in the time of making that loan worthy? You know, and how can I do this on a shoestring? I mean, I'm sorry. People come in to the DeAnna Center and they think Scott and I must have millions of dollars. So we must have some big investor helping us out here. We do have a primary investor from our first 3 years, which was my mom and dad. Oh, that's my little doggy, which is, oh, there's Hanu making noise. Yeah. She's our little garter. But my mom and dad did invest and did support us with, you know, making this happen. But ever since, we've been doing it penny by penny. Every single place we have built and developed has been penny by penny, just good budget and how can we get these items we need. Like every one of the tubs in the bathhouse was Craigslist, you know what I mean? So much of the furniture and things were like trade, you know? And so you can do this and be creative and make your projects work, no matter which one it is. But you're gonna have to go through the steps. And that's what hibernation's about. It's not lazy. You know, you do get to maybe sit in a tub and do some of this. You know, you do get to sit by, you know, your heater or fire and do this and just let the outside world go for a while. And why not? Like, we're isolating right now. Why not? You know, and you can still live life. So, you know, again, an hour and a half a day could actualize whatever you really want to bring in for 2021. And so that is my sweet little jumped into it. Just what I want to provide everybody to think about as we go into this, because it can be such a struggle to hibernate. You know, we either struggle with lazy, like I'm not doing anything, or we go into depression and it just takes us into a really heavy cold and a damp cold, instead of a like, I'm going to keep the fire stoked inside myself and I'm going to put my head and my heart together and I'm going to start communicating in between my head and my heart. My voice is in between and there's truths in there and they're still fired up, you know? And if you have any anger about who knows what that's going on that isn't congruent with who you are, because I sure have a lot of that going on. Things are not quite congruent to who I am. So, you know, we're experiencing that too.
Right.
And that fire has to get used. So you don't want to go into pressurized fire when everything's going cold and then all your fire's trapped and you feel like you're just going to be all,
Yeah.
You want to make sure you really, you know, okay, how do I harness the frustration I have and how do I keep my fire stoked if I've lost it? So Virya, in Ayurveda, we're always tracking Virya, Virya. So for any of you vet heads out there, you probably know what Virya is. But Virya is the most highest potential you could possibly make change with. Whether as a practitioner, I'm thinking about my client, or whether I'm thinking about myself. The highest potential of change that can be made is with hot or cold. Recognizing the client is hot, they need cold. You can take it further. Where are they hot? Liver, lungs, emotion, both, you know, but hot or cold. And when someone's hot, you give them cold. And when they're cold, you give them hot. And we don't want to get very far away from those basics. We don't want to make them so simple we don't use them. Because guess what? When we don't live in the simplicity, we don't have simplicity. So if we don't live in the simple, we literally are making life more complicated just by not trusting simplification. So hot or cold, one of the most important things we can do. And going from hot to cold can be really challenging on the body. So just really think about, like, how much do you need to move through your intestines? Because that's, again, follow through. We started fall 3 months ago. Do you remember that?
That was yesterday.
I know, it does feel like yesterday. And we were talking about intestines. So we started this whole process talking about, like, follow through of the intestines, and you want energy to be going down and out so that fire doesn't rise up, or you don't lose it and then you have nothing to rise. So this is also the last week of kind of cleanse, really. It's the last week of cleansing and clearing the intestines. I mean, eating a clean life is ongoing, but this is it for intestines. So think about getting a little senna tea and just let yourself kind of really go, move your bowels and use the restroom a little bit more than usual, or take some of that magnesium that just really boosts the blood but actually clears the intestines, and that type of a thing is important. So yeah, you also want to follow through with the intestines where we started for the season, because guess what? Winter just isn't about cleansing.
No.
It's about warming, blood building. So, man, how many times are we going to come back to spices? A lot.
Right.
Because this is a spicy time of year. So you have a question for me?
I do, and I also want to say hi to some of the folks who are here. We're seeing Martha, and I think that's pronounced Aliyah. Tali is here.
Oh.
And let's see.
Hi, sweet lovelies.
And Trish is here. So, hi. Lorian's here too.
Oh.
Yeah, so
Hi,
we're really
everybody.
glad to see you. So our first question is actually from Martha. She popped that in on Instagram. That is definitely one of the places you can submit a question, and you can submit it beforehand. We'll keep track of it. That's what Martha did. Thank you. And she's wondering, Dee, what are your top 5 picks for attaining and maintaining optimal health? Can you succinctly?
Oh, geez.
I know Atlantic Gray is going to be on there.
Well, it's I love this question. Yeah, I have plants going through my space, so I can think of my top 5 pick plants. But I guess I'm hesitating only because I'm almost moved right now how beautiful this question is, according to what I just said. So I was talking about simplicity and just how do we trust simplicity? And if you don't want your life to be too complicated, guess what? You got to keep it simple. So I think I'm going to go to the 5 pillars of health, the 4 pillars of health, but I could give it 5. But really, it reminds me of my body mapping class, which actually starts January 7th, putting a shout out for anybody who wants to take it. And we'll talk about it a little bit later. But I think we have to think about the 4 pillars in Ayurveda: breath, rest, eat, drink. So the salt fits in the drink. Hydration, right? So waterways and thoroughways of water are absolute number 1. If we don't want to lose the oceans in the earth, in the nature, we don't want to lose our water moving around in our body either. So that's drink. And then there's the eat, which Martha knows, from class, but quantity, quality of food, and always eating your 2 anjalis, 2 handful size of your meals. So not over or under eating, and eating quality. So I think these are really important details in eat, right? And think about, proteins and veggies being your primary, and less meat and more, variety of proteins beyond meat. So these are just foundations, like the foundations of food, the foundations of water, and then there's the rest. And rest is a really interesting one because it's about getting good sleep. And I think it's about getting to sleep before you get a second wind. Like if you get a second wind and you start getting on your computer, you're going to be up and you're going to have really restless sleep. but it's also about resting times in your day. So, like, it can be really hard for me to get out of just what I'm doing and actually get out the door midday and go take a walk around the block. But that is a form of rest because you're taking time out of your schedule. So I think rest, in a weird way, this is going to sound kind of strange, but rest kind of includes, exercise, even though that one fits very deeply into the next one, breath. And exercise brings on breath, blood flow. Let's remember, when we breathe, we're collecting oxygen. Best anti-inflammatory we've got. So we've got anti-inflammatory is breath. We've got rejuvenation in rest. We get energy and power from eat. And we get cycling of fluids, and we get to like water our human plants with drink. Now, in the body mapping course, I added a few more things in there. I live by the elements. They are my primary guides. They are my everything. They have proven to work. They tell me everything I need to know. That makes them simple for me to trust. So what are you gonna trust here in your health? And for me, that's elemental. So we're back to the hot, cold, wet, dry. Do I need nourishing, which is more winter, or do I need cleansing, which is more summer? Or do I need hot and do I need cold, and how much of each do I need? And then the other, thing I talk about in body mapping, which is the basics of health, is individualism. Who are you as a human? What's your primary constitution? Some people are more, as we know, some people are more sharp. Some people are more dry, Some people are oily, and, some people are slow. It's just differences. So who are you? And can you eat opposite of who you are? Because if you are in a pattern that is not serving you, the opposite is going to be the balancing act that is going to support your personal homeostasis. So I just think of that. And then if I was going to put that into a plant form, and we'll see what the next question is, I would say aloe, because we need an anti-inflammatory that is still hydrating. We need a bitter that is still hydrating, because we have pollution outside and we have stress. And then we have like whatever patterns each individual has that's just natural and real. We have patterns that are not serving us. And so we need aloe. Somebody might need to put a little ginger juice in that aloe, or cinnamon, and warm it up a bit because it is cold. But still, I find every human I meet at the point of just pollution alone, we need that aloe to keep us hydrated and keep our liver feeling like it's got a little juice to work with. It's got a lot of jobs. The other thing I think of is lemon balm. I think lemon balm is so easy to grow. You can, put it in a pot in a sunny window in your house and it'll grow. But lemon balm is so important for the nerves and the hormones. So the balance of your endocrine glands, your glandular health, and your nervous system. And it's just super friendly. I mean, lemon balm can be used in pregnancy. It can be used in, with children, with animals. I mean, it is just an everyday, all around kind of full nervous system tonic to me. And so that's another one I think of too. And then I think of spices and using spices as my primary way of staying healthy. If I'm going to eat food every day, I might as well put my medicine right in my food. So I think of spices as just this world of medicine that is underutilized, and I get to go global. I mean, I love the idea that I'm traveling just by eating, because I got my spices on there, so I can think about where that spice came from, and then I can relate that to kind of where am I going right now, and I get to have a global experience with my food, which always makes me happy. Those are some of the things I think of for this question. I think of the pillars. I guess I'll just really say, there's 4 tiers to health in Ayurveda too. So there's the 4 pillars, but there's the 4 tiers. Psychology, so your emotional health is always first, but that can be hard. And then our food is medicine. And then we have remedies and supplements. And when do you need to supplement your life? Because maybe your emotions or your food, are not as perfectly balanced as you want. And then there's the fourth tier of health, which is when do you see a practitioner? When do you go and find help? Maybe you can't get even to the basics. If somebody can't even, get to that salt in the morning, you really might need something or some way or someone to hold your hand a little bit more and take you through those steps on the regular. And I'm working on that, by the way. So not only is the My Body mapping course starting January 7th, we took all of the recordings from the last, I think, 3 years, right? Mm-hmm. And we put it into beautiful videos. And you've got me 7 weeks in a row, mm-hmm. Giving you advice and taking you through these pillars. The body mapping course is not just designed for people who don't know the basics, but it is good for that person who just needs the baby steps. But if you've gotten really big in your ability to heal, or you've explored a lot of modalities to heal, I still think this course is important because it brings you back to those simplicities and those basics that then you can take into any one of those modalities and get the most out of it. And then I also suggest this course for the practitioner, or the practitioner to be, because you're going to have to speak the foundations of simplicity. You're going to have to speak, eat, breathe, rest, drink, and individualize for your client in front of you. You have to learn to do that, and not to get too far away. Like, this perfect formula I made for you is going to serve, it's going to heal, It's not just about the formula, and I love to formulate, but it's about, like, who is that person and what do they need, and then you make the formula, and it's very powerful. So really doing that. And by the way, can I just do a little shout out before we go to the next one? I'll say this probably a couple times. Hope you don't mind, but it's important that we keep the DeAnna Center ball rolling right now. So if y'all would help us do that, and thank you for showing up. You're doing it right now. But I am giving a free spot for the My Body mapping course. And it'll, all you got to do is you got to like the post, comment, tag. So you tag 3 friends and you show that you follow us, and voila.
We're going to pick one.
We're going to pick somebody.
We've got a post on Instagram starting today. I think we're going to be running this giveaway for a couple days. So yeah, be sure to hop on. Let us know when you comment, like, kind of what are you really needing out of the course? Mm-hmm. Because DeAnna likes to really tailor it to the folks that are there for sure.
Yeah.
And then, think of 3 friends who you think would really benefit from just kind of dialing in the basics and the foundations, and tag them. And we're going to pick a name. And it could be you. It should be you.
Yeah. And this could make a really good gift for someone you love who you think is ready to make some big changes in their life, but they just want the basics to do it, and maybe not have you tell them, or you want to be off the hook of helping them, and you can pass them on to me and the course, and they'll have all those videos. And then each Saturday, so the 9th, January 9th, all 7 Saturdays in a row, I'll be there for 2 hours doing Q&A and personalizing it. And we all become like a really sweet group helping each other. So it ends up being a beautiful group support, and I invite you to join me. But yeah, Martha, good question.
Very good.
Really good question.
We've got a nice little handful of questions coming through ever since.
I'll go quick.
So the next question comes from Trish. She's particularly needing your skills in Tibetan Cranial Sacral for her guy post-stroke. But she is wondering suggestions for a blood thinner. He's seeking something long-term and less invasive than what he's been offered.
Okay. So Yeah, this is a good question. I've had people ask me this question many times. So I've looked up some of the medications. I'm not an expert, I'm not a doctor. But I have looked up a few different things to understand their functions and make sure that we're not doing anything that could hurt somebody in the world of blood thinners, because this is a really specific question. I'm going to give you my first one that I basically did quite a lot of study on. And I made sure that someone could use it even as a heart and a nerve neurotransmitter tonic, even if they were taking medication. But many people have been able to not take the medication and do cypress essential oil. So, not blue cypress, but regular cypress. I have it. It's a beautiful plant. Um, I started researching it because it's such a good blood and heart tonic. And I started looking at some of the chemistry and how similar it was, because that's what I try to do with essential oils. I try to look for similarities between kind of the chemistry of a medication and the chemistry of an essential oil. And I'm just like, trying to dig deep to do the best I can as a aromatherapist. I'm not a full master's in chemistry or anything, but I feel really confident, and I know that I'm giving you safe advice. So it would be the starting point. So cypress essential oil, 12 drops a day is where I started dose for somebody who is making a personal decision not to take a medication being offered to them. If somebody is taking a medication and they want to maybe half and half, and do that with your doctor, because I think that's the best way to do it. They're pretty open to helping you get off of meds. So if something's working, they're pretty open. I would say it's more like 6 drops a day, and then you would go up to 12 a day as you were changing with your doctor that medication use. So that would be my go-to. I have a couple other ones I want to make mention of that are not literal blood thinners, but I hit on this concept of the fact that you want to thin the liquids in your body. So you could think about how much congestion is there, and the less congestion he has, the more thin his liquids are, since congestion is coagulated fluid. And then I started going, okay, well, that helped. I noticed it helped people a lot. So get the congestion out and take out the congestive foods, dairy, gluten. But the other one was the world of sour compounds. So sour liquefies anything that's in the body, plaque, heavy metals, but it would take a long time. But, it really, and it also sloughs the intestines, but it's safe for year round. So it's not considered cleansing. It's actually, sour is enzymatic. So it's blood building, and it liquefies whatever is too thick or coagulated or plaqued up on the edges of your body. And that was a game changer. And I've done this with, I don't know, I can think of 4 people in my life that I've done this with who have had strokes. 2 personal people in my life, and 2 clients I can think of. And that, I think, is a very, very important piece. So sour compounds all the way, cypress essential oil, 12 drops a day. And that would be probably where I want to, well, Trish, I think you know this plant really well. Schizandra berries, goji berries, those are all sour. Raspberries, those are all sour. But I feel like Schizandra berries might be a really good one here too. But it is kind of dry. So stay hydrated, because, you got to have liquids for them to flow or even be thinned. Yeah. So stay hydrated with those sours. But I feel like that's a great place to start. And I think of Tulsi, but it's not a blood thinner. I just think of it as like building blood, like blood, healthy blood volume, oxygenating blood. Like oxygen's one of the things that actually helps with the viscosity, the thick or thin of our blood. And so I think of oxygen, a lot of people do ozone therapy. It's done me really well through the years too. But I could see how ozone therapy might be really smart there too. Yeah.
Great. All right. Let's see. Our next question I'm seeing is from Claudia. Uh, Claudia says that she often feels a throbbing at the base of her skull. What might be causing that, and what can she do about it?
Okay, so base of the skull. I'm thinking that's frontal bone,
Base.
base, occiput. Base doesn't. Okay, I get it. Yeah, occiput.
Mm-hmm.
Okay, so you have your occiput that runs across the bottom, right? At the bottom of your cranium. It's the lowest of your cranial bones. So it runs right across there. You can usually feel it like it's a little ledge, And then right above, because your occiput is maybe the thickness of your hand, And so right above that are these two bones that come together right here from behind the ear, and they meet at the top, and they're your parietals. Okay? So sometimes if we, like for me, I hold my neck up a lot because I'm always trying to hide my double chin. It's just my thing, which is what kept me from doing videos for so long. So I'm always like, you might notice I'm just giving this away, but I'm always like, bring it down, DeAnna. But it makes the occiput push up into the parietal, and that means there's two bones colliding, and that can cause a lot of pressure under the cranial bones. So that would maybe be one thing I'd consider is how do you correct that? How do you bring your jaw down? And you got to get a gua sha, and you want to start gua shaing in between that occiput and those parietals, and then you take your fingers and you tuck it up onto the top of that occiput, and you start just putting the weight on your elbows, and you just relax your jaw, and you start pulling that occiput down. These bones in a perfect cranial world are floating, so they're movable. And it's really wild when I'm teaching cranial in class and you just watch these bones move around. Everyone's all, what? And it rearranges your brain too. So it really does. So it's about holding patterns. But I think your occiput needs to come down, and that makes the parietals that need to float and ebb and flow with the movements of your body then can breathe. And that's probably the main thing. The other thing I might think of here is, what if your lymph is congested and it drains here to the clavicle? And what if the lymph in through your neck and behind your ear, and then we have lymph nodes all along that occiput? What if those lymph nodes have gotten clogged up, and your lymph is your immune system? So what if your immune system is feeling the cold, or what if you've been at a computer more in a pandemic than you expected to be, and we start crunching everything up and everything gets pushed in? So another good reason for that gua sha, you might want to get some oil on there. My favorite for this time of year is ashwagandha bala, because it's really nourishing and warming. And you just put that ashwagandha bala on there and start massaging, and then get that gua sha and start doing those strokes down to your chest from your neck. And really, if you have pressure built up, which is pain pressure, you got to figure out how you're going to give a pressure release valve. So how are you going to actually meet that pressure and move that pressure? So make sure you're using your breath too, since again, that's good oxygen, and we need to be able to get oxygen to our brain, and it moves through those bones. But that's the thing I think of. And then there's some allergens that could be causing that too. So unfortunately, if you're eating a lot of nuts or chocolate or drinking more caffeine, a lot of that is happening right now, because we're kind of like, what can I do? Yeah. I'm at home where all my patterns are.
Right.
So,
Holiday coffee drinks.
Exactly. So those are the things that would be considered irritants for somebody who has pain or inflammation in general. Nuts, chocolate, coffee. It's an unfortunate list. And then you could start looking at other things, like, are you getting enough protein? Because if you don't have enough protein, you'll crave sugar. And you can get headaches from protein deficiency. And so you might really want to consider that too. So those are some of your options. I like giving options because then you see that a symptom doesn't just land in one place. And then I'm hoping, as I'm presenting options to you all, I really hope you're going inward and being able to say, oh, that one sounds right. Like, yes, I feel like it's crammed up in there. Or when I said that, you might have been all, I don't think that's crammed in there. I don't put my chin up. And then, well, guess what? Check off the list. And then you can say, oh, but I've been eating a lot of pecans this holiday season. And then you can be like, okay, maybe I need to back off on the nuts. You know, so which one of those suggestions sounded right to you? The immunity lymph part, the bones might be crammed up and pressurized, or maybe there's some food irritants that are, you know, making fire rise since inflammation rises, you know. And that's how we start tracking our symptoms. There's a few options, and then you start saying, yeah, that one matches me. And then, you know, you got your answer, and then you just got to pick up the gua sha and get to work. And you'll need the aloe if you chose the food irritant list. If you think those are the foods you're eating, then I would start doing a half a cup of aloe every morning, every night. And that'll pull that fire out of your system pretty quick. Yeah.
Yeah, whenever I'm experiencing pain, I also just think about the foundations. When's the last time I had a drink of water? And am I breathing?
Absolutely, because
Yeah.
it really, really leads you to being pressurized and contained, and the fire's pushing upward.
Yeah, yeah. Alrighty.
What's the next one, Andrea?
There's a lot of good ones, and some awesome people are here.
Oh.
Sergio got to be here.
Sergio,
Yay.
my soulmate love.
And Virginia's here.
Oh.
Really exciting. Molly's here and Dana's here. I feel like this is romper room. And then
That's really sweet. And I see Dana.
Yes.
And I see Molly.
I don't know if you guys remember romper room.
We sound old now.
Sierra's loving it, and Jenny's here. All right, Jenny asks, what are your go-to supports for thyroid and adrenals?
Okay. Yeah, and you must already have an understanding of adrenals and thyroid being connected to even be asking in that way, you know? So, and I like that because, you know, I'm all about people realizing that when the adrenals are really low and fatigued, it's going to leach from the thyroid because they work as a community, your glands. So I like that. And so that tells me too, though, that there's some adrenal relation. So I'm just going to say the word H2O, and then hopefully you can take it into the trinohydration. So let's not forget about the basic, because if the electrolytes, EFAs, and probiotics are not stabilized, that question, that help for the thyroid and adrenals will never get actualized. So let's just go back to that simplicity again, and now we'll move on. So one of the things that helps in the regulation of the gut, which then calms down the adrenals, because when our digestion is working, we have a sense of health in our body, and that calms down our glands. And there's an amazing seed. It's the singer's seed. In fact, Billie Holiday kept them in her pocket, and she would chew on them for the melody of her voice. And it's called fennel. Sweet little fennel seed.
Fennel.
So fennel is rocks for thyroid issues. I mean, it is just really good for connecting your metabolic function of thyroid to the stomach function, which is its primary. And by the way, if the adrenals are leaching from the thyroid, inevitably the thyroid is going to leach from the pancreas, another one of your glands. So it's really a trine to consider. So it goes back to gut. Pancreas is the gland of your digestive tract. And so if your digestion's good, your adrenals are calm, you don't need your thyroid, doesn't affect your pancreas. Fennel takes care of all of this. And there's another really brilliant one, and then I'll give you dosages, and that is cardamom seeds. Could this not be the most pleasant remedy ever? This is like the most pleasant remedy ever. They're kind of my everyday remedies, so I take these a lot, and it's to make sure I don't end up with thyroid issues like all the other women in my family, and I have been able to do that. So I talk about a teaspoon of fennel seeds a day. It's really good for bones. It's great for all of your tissues, your gut. It's full body. And it's just one little teaspoon. Don't overdo it. And you're just going to nosh on those seeds and you're going to chew on them and you're going to get the amylase built up in your salivary glands and in your mouth, which is the beginning of your digestive tract. So it's all about the enzymatic base of your mouth. It's also great for dental care. So you want to just really chew and it'll clear things off and it's got great fiber and then you swallow it. And I just want you to little couple seeds at a time, put it in a cute little bowl so you want to go to it, put it right out in the forefront so you don't forget. And then put 7 cardamom pods in that bowl. And throughout the day, because you all know I'm about sacred 7, how many things run in cycles of 7 in the world? Oh my gosh, 7 oceans, 7 continents, 7-year planet alignments, 7 tissues, 7 chakras, we've got 7 glands. And so 7 beautiful cardamom pods, crack them open, put those seeds in your mouth. You're going to realize how nourishing they are because they get all slippery and demulcent, and just chew and chew and chew. Nice thing about cardamom, it's also great for breath and liver and odors of the body. There's just so many things these 2 beautiful spices have to offer that are truly, truly medicine. When I'm in India, and Martha, we would have been doing this together, but I give out cardamom pods throughout the day. And when something doesn't, smell great, or when we're in a little bit of a dirtier, a little bit intense region, or something's going on and everyone's just a little like, this is not home. We pop a cardamom pod in our mouth and we just chew on the seeds and it just helps you digest everything. Sometimes when you're traveling, you have to even digest people living in really harsh environments, people living in ways that I never have to think about. And then all of a sudden I realize, whoa, that's somebody else's reality. Let me take a little check here on my spirit and how I feel. And we have to digest those things too. And that's the thing about stress. We have to be able to metabolize stress. We have to be able to take a moment out and be able to be like, whoa, wow, I'm totally feeling this. How do I cycle it? What do I do with it? And that is the beauty of fennel and cardamom. They're going to give you that relation to let me nosh on this in my mouth. Let me think about it. Let me put that down into my body. And then let me see what that can translate to that might look different, than how you're feeling when everything is just really pressure's on. I'm a huge fan of seaweed for this question, but you have to not be medicated for your thyroid. So if you're medicated, you can't do the supplemental seaweed, but let's just start with kelp and eat as much as you can and maybe get some kelp capsules. Don't take straight iodine unless you know that's exactly what you need. We don't have iodine deficiency and that'll overwork your thyroid. But seaweed, that is my multivitamin. It's protein, amino acids, electrolytes, vitamins, minerals, all in one swoop. So that would be my go-to for what I do for my thyroid and my stress levels. I have them too, I just keep laughing, but I have them too.
Yeah. All right. And let's see. Martha has a quick question and wondering the best way to clean a wood gua sha. And she wonders if it's okay to put oil on a wood gua sha.
Oh, yeah. So I definitely don't with my own gua sha because we sterilize them and everything here, but I keep the oil. So usually if I'm using my gua sha, I usually leave the oil on it and I don't even wash it and I just rub it in. So absolutely put oil on that gua sha. The other thing, and hopefully, a lot of the gua shas we sell, they're buffed multiple times. So you don't want them to sit in water or they'll, get rough. But they should hold up if you keep them oily. And if it didn't, just get a little bit of sandpaper and just sand it down, just give it a good sanding, and then, dip it in some oil and let it sit for a day or two, and then really rub that oil in. Give your gua sha a massage, and then it'll keep massaging you. So, oh yeah, absolutely. And if someone made you a gua sha that was made out of soft wood, which are not what we sell here, but if you got a gua sha somewhere else or you made one, you can't use soft wood. You'll have to keep sanding it, and the oil will make it softer and softer and softer. So a gua sha needs to be made out of any hard wood, walnut, olive, cherry wood. They don't do good in redwood. They don't do good in cedar wood. Unfortunately, we wish we could make gua shas out of those, but they don't last. So hardwood is a key too if you're going to make one. Or what kind of wood do you have there?
Very good. All right. Gail is asking about puffiness below and around her eyes that she's experiencing, and she also experiences dry eyes. What do you recommend?
Okay. So if we are a glass of water, just think of yourself as a glass of water. The top of our head would be the top of the glass. And if your glass is half empty, or if it's even less empty of water, there's not enough volume, there's not enough water to keep everything cycling through your body. So the first thing I am absolutely going to highly suggest is to get my Trying to Hydration ebook. It's only $5.99, but it's going to give you the three most important things you need to do for keeping water cycling and absorbing into your body. And I think that is going to be just a very important thing to put in there. So really, that's the first thing about the dry eyes. And some people get ringing in the ear, and some people will get like a lot of clenching in their teeth. These are all dry, tight experiences. Some people will even start getting bloody noses or really dry in their nostrils or dry lips. Everything is about hydration. So that I just think is a true long term. But the other thing you can do for dry eyes that makes a huge difference is put a drop of clean organic castor oil in each one of your eyes each night. I do have many people who don't use any like eye drops anymore. It just takes castor, maybe, a good couple weeks, just a little smudge in there or a little drop. It's goopy. You're just putting it on your eye, going to bed, and it's great for calming down the cranial nerves, for helping you sleep. And it's actually really good for the skin around the eyes and anti-aging. So it's got a lot to offer, but you really want to get it in the eye, and it'll start lubricating your eyeball, and it'll soften your tear duct, and it'll keep things nourished enough that you can start developing, more lubrication in your eyes. So that's just kind of the first thing, trying to hydration and castor. Then the other part of this question is the puffy under the eyes. So our whole face, which I will plug my body mapping course again, starting January 7th, because our whole face is a map, and our tongue is a map, and then all of our symptoms are just telling us what we need to know. We just got to figure out what the map means, and I'm here to help you with that map, because it's not actually hard. But if I was going to teach you that face map right now, I would be telling you that right under your eyes is your kidneys, and right at the side of your eyes are adrenals. Okay, so this is kidney space. And if you're having puffy and watery, then you know that you have sluggish kidneys. So they're not cycling, they're not filtering your blood and cycling the volume of your water. And that's what your kidneys do, is they filter blood, and they do it with the efficiency of water volume, which is what we call our blood pressure. So blood pressure is water volume. If you have dry eyes and this going on with your kidneys, with like weak kidneys, you're probably might have low blood pressure too, because it would go in that vein of just not cycling enough. So again, you got to get the water volume up. that's going to get the kidneys to cycle, and then they're going to show you that they're not sitting on fluid. What can you do about that? Well, that's a little more long term. Some people, are a little more kidney deficient, even in constitution. It may look just like the eyes in many of the people in your family. It doesn't make it easier to have it, right? But it at least relates to genetics. So some of that might not change. But I'm going to go back to the gua sha. I have to. It's just the most amazing little tool ever. I never get sick of talking about it because it changed lives. It just does. But you could do a steam inhalation with some rosemary. Okay, just a little steam with the towel over your head. And then you go in with the gua sha and just be gentle. It's really gentle, tissue in there. And you could really just gua sha that space in there. And you could just kind of soften that. You could go up in here and open up that little, mucous membrane that sometimes gets clogged. And then you can just start rubbing it out. But it is amazing how much sitting water can be activated and your body will start cycling it. And that includes having edema in your feet or edema in your hands or edema, puffiness under your eyes in your kidney nerve line. So that's literally where the nerve system ends, is for kidney, is right here. Yeah. So that is some of the things I would think of for that. And if you run cold, you need way warmer food. So think watercress and arugula and daikon and kimchi. Think of some warm things that are real peppery and pungent, and that cycles the fluid in the body too.
Great. Carrie is wondering about carrot seed for birth control.
Oh boy, this is a big question, and we're live, and I'll show you. Great question. Okay, so I'm not going to say this, we don't have statistics here. So we don't have this is 97.9% accurate. This is just a really amazing plant that does have a lot of protective qualities for the ovum egg. So the way wild carrot seed works, which is the plant Queen Anne's lace, right? So for here, you're driving home, and you got Queen Anne's lace all up and down the freeway. So it's super high tension, vigorous, one of those plants. Fennel is the same way. You look at where they grow sometimes, you're like, how are you surviving here? Getting trampled on without any water. So it's a survivor plant. And it's really about doing protective. So it's most known for healing wounds and getting discoloration out of a scar or softening scar tissue. So it's a skin protectant. But I learned this and did some really wonderful, and I'm gonna give Susan Weed a big old shout out right now. She is one of the most amazing, phenomenal herbalist women who is just a pioneer. I mean, she has been advocating, women and choices and people being able to trust plant medicine for longer than I think I've been alive. So you know what I mean? Just really, she taught me so much. And so she really worked a lot with, and in one of her classes, she was teaching about the tincture and then also grinding up the seed itself. But that hasn't really shown me to be enough medicine. And it just wasn't giving me that oh my God, this is working. And I was tracking myself. So I've been doing Queen Anne's lace, wild carrot seed as my main birth control and only birth control since I was 19 years old. I'm 51. I chose not to have children. I am still fertile. And I have always been fertile. And that's the beauty of wild carrot seed. Doesn't change your fertility. Doesn't take away your options or your viability. It just protects that egg. So if sperm does go upstream and go to implant into that egg, the egg is kind of got such a strong outer coating, that it doesn't penetrate. And I like this because you're not getting, for instance, some plants you get pregnant, but then it sloughs tissue off. And I don't like that idea. Like I want to do whatever I can to not create life. You know what I mean? If I'm going to be doing a literal birth control, unless I'm choosing something else. So these are the things I think are important to know. The other thing is, I highly suggest you get a fertility lens. I've been hearing they're harder to find, and I haven't done any personal research because I don't use one anymore. But but I know they still exist. So you got to get a fertility lens because you have to be able to track your cycle, and you have to know your cycle. You have to know from when you stop your menses to when you start to ovulate. You'll see nothing on the lens. And then as you go into your ovulation and as you go to full prime ovulation, and then you count how many days is prime, from the moment you see that little structure they teach you about in the lens, all the way through until that structure leaves the lens, is considered your fertile times. Doesn't mean you can't get pregnant at other times. So I don't like to give this information out and play games with like teens or even people in their 20s. Like I don't like to make this like, oh yeah, just do this, you'll be fine. You got to be responsible with this. So you got to track your cycle. You also have to be very respectfully using pull-out method. And there's also times when I'm in my prime and fully fertile, and for me, not wanting to get pregnant, that's kind of a bummer because it's 5 days of a long fertility. But if I'm in that space, I'm also wanting to be really, I want to make sure I'm having fun with my partner, but I'm not necessarily, having full intercourse with my partner. You know what I mean? So think about that too. Like, when do you refrain and have fun some other ways? There's lots of ways to have fun. So just be fun some other, play. So just things I have to say around this question. I can't just give you the dose. It would be unethical of me. It would literally be unethical for me to just give out like, oh yeah, use wild carrot seed, no big deal. So please think about those things. And now, from the moment you see that little fern in the fertility lens, all the way through your prime, all the way until it's gone, which is about 2 weeks out of the month, you're taking 3 drops of wild carrot seed essential oil. I have it, but it's what you need to get it straight to your blood. It's got to get straight to your reproductive. Anything, tinctures and herbs go via the gut. And carrot seed is awesome for the gut because it heals tissue. But that means it's not getting to your reproductive. So essential oil is the way to go. You don't want to overuse it. It's slightly heating. And it hasn't aggravated my pitta all these years, so it's not extreme. But it's 3 drops a day during that timeline. And that's as short as I can be with that question, but I like that question because I answer that question a lot. People want to know what they can do other than an IUD that is affecting them in adverse ways. So,
Yeah. It's all about empowerment.
yes.
So it looks like people are really jazzed about the fennel seed cardamom.
Oh, it's so good.
Remedy. One person asks if it is okay to take fennel and cardamom as a part of a chai blend, or do you really need to be directly eating those two?
Okay, if the chai has black tea, forget everything I said. So, sorry. No, if it's caffeinated, then it doesn't count. And then also, what you would need to do in that chai is you would need to still eat the seeds.
Yeah.
So, in Ayurveda, that's why they powder all their herbs. They powder them because they put the powder right in the teacup. You pour your hot water over it, and then you drink it like a slurry. Like I remember when Dr. Gupta was visiting me for the first time from India. It was his first time in America, and we sponsored him to come over. And I made him some beautiful tea from the garden, and I make it, and we sit down, and he keeps looking over at the stove, and he keeps looking at the stove. And I'm like, what's on the stove, or like, what's over there? And he goes, you leave all the plants in the teapot? And I was like, well, yeah, I strained your tea. And he was like, but the plants is where all the medicine is. And I was like, oh my gosh, like we leave our plants behind. That means we leave the fiber behind. We leave all the vitamins and minerals that are still embedded in the fiber. We only got the chemistry that was water soluble. We only get what's water soluble. And that's why I give a lot of suggestions of essential oils. You're getting like full chemistry straight to the blood, but it is going to be different. So are you willing to do your chai? You know, are you willing to do the chai with this concept of eating the seeds, you know, that are in there? Are you going to make sure you get a teaspoon and your, 7 pods? You know, there's my little puppy again. You know, so are you going to, be willing to do that is kind of the thing. So I would say, come here, Mother. Sorry.
Visitor came through.
You shut that door, please. Thank you so much. Okay. So I would say we should keep the fennel and the cardamom pods separate. And you really get that as something individual, and then you could just do your chai as you do your chai. Yeah.
All right. Let me just...
Good thing I don't have all my animals here, because then we'd have a bunny running around,
yeah, and
we'd have 9
kitty.
chickens, and then we'd have the kittens. Like my house is like a little animal farm.
It is. All right. We've got a question from Sierra.
Okay.
Sierra is hoping for estrogen decreasing tips. The cancer that was in her breast was ER/PR+, and she's trying to avoid their synthetic drugs.
Okay. So, interesting and kind of somewhat challenging question, but I think most people know I don't mind a challenge. I just think of multiple things that are needed here. So there's no one surefire or group of plants that I would say fit into a category of just decreasing the estrogen. I'm assuming you're already decreasing your estrogen load, like plastics and chemicals, and where do you live, and are there hormones in your dairy or your meat? I would hope you're looking at like, where are things estrogenic, and you're really avoiding those things. And then I want to give you some good news in this question, which is if you're avoiding those and there isn't new exposure, our bodies actually know how to slough old estrogen out of our body. Like we know how to do that. In fact, as women, and men go through a cleanse every month too, but women, it's an obvious cleanse, and that is why we have our menses. Like that's exactly why we let out blood, is that we have collected a whole bunch of hormones that we did not use to build a baby. And since we did not build a baby, we need to slough those hormones out. So one of the things I talk to people about is, and this goes back to the birth control question. I don't know how old you are or what's going on, but if you are using birth control, I think that's probably going to be a very hard thing to be able to control. That's going to be hard to manage. And so even though you're going to need to know about carrot seed and get to know your body a little better and track your fertility, if you are in a fertile place and you're not menstruating monthly from birth control, I think this is a really, really tricky thing. And I'm not a fan of birth control. I'm not a fan. I'm a fan of people not getting pregnant if they don't want to. But there's a lot of ways that can be, taken care of. So I want to talk about that, just like where could there be things that aren't allowing you to menstruate and aren't allowing you to slough off. Then, no matter whether you're doing that or not, whatever choice you've made, because we all do get to choose what's right for us, you could be doing douches, and you could be doing very nourishing mineralized douches. Let's remember women have been douching for centuries to clear out their system, to finish the end of a menses, and to make sure we're not building any bacteria or growing bacteria in a very moist region. And douches are used even for nourishing the vaginal wall as well, you know? So if these are not cleansing douches, you know, we're not talking about where we stopped douching, which was like in the 70s when Massengill gave us a bunch of white vinegar and told us we were dirty.
Yeah.
And then it was the feminist movement, and a bunch of us were like, screw you.
Yeah.
And we stopped douching. But let's remember that's our right. So if you want your body to release estrogen in the way that your body knows how monthly, douching every month is great. We never do that during menses. We always do it after or the week before, anytime other than with menses. And I would do the kombu seaweed, just like I have people do with enemas. Mineralizing, nourishing, high protein content, which is great for healing tissue, but just really clearing that space out. And if you want to know more about this, I am actually doing a webinar in January on the pelvic floor. And I'll be talking about steaming the pelvic floor and douching for the pelvic floor and the lymph that is up through the pelvic floor. And so much of it is about keeping things flushing and moving through the system. So I'll be talking about that more. I also have a webinar in later January, which is on the topic of just inflammation and what do you do with inflammation and how do you track inflammation. But the pelvic floor one's going to be really precious. I'm excited to teach that class. But I think of that, and then I also think of the intestines because, you know, it's very important to clear down and out if we don't want anything to be accumulating and staying in. And it really is that basic in some ways, but you have to trust that concept of like clearing my intestines keeps estrogen from my body. Yes, it does, you know, because it'll put you into a cleansing. Oh, also hormones die off, turns to liquids. So sweating would be another one of the ways that you would want to think about sloughing off excess hormones, sweating. And that's one of the things that is the great value of the sanctuary, which, you know, if you want to get Panchakarma right now, you know the sanctuary is open to you. So it's all about getting a retreat. Like if you come and do a Panchakarma retreat with the doctors, they actually have essential permits. And so it includes the bathhouse. Yeah. So, I mean, there's things happening at the DeAnna Center now. You know, we've had the store open all month, but we're going to be closing it next 23rd. It's going to be closed. And we'll have to see if we can reopen or what needs to happen. But we do have MD Ayurveda here, and they are extending into January because it is working so beautifully to have them serving people in the space and doing traditional Panchakarma. I'm actually learning a lot. It's really nice. And it's nice to have that steam room stoked up and on and hear the bathtubs running. I'm like, oh my God, it's like really happening. So if you are wanting that, you know, bathhouse bad, you know, you might as well just get a, you know, little Panchakarma. And they're doing 1 day and 3 and 5. And they're actually just finishing a 14-day Panchakarma. Can you imagine having the bathhouse all to yourself? We've had this lovely woman here who's been here for 14 days. She has the whole place to herself. It is incredible.
Yeah, that's amazing.
So
That's a retreat.
but sweating, even in your tub or even in a shower at home. Yeah, otherwise come on down and meet the doctors and get in the bathhouse here at the center.
Yeah. All right. Well, we've gone over an hour. Do we have time for one more?
I do.
Okay. All right. Gail has scalp bumps
Okay.
that really itch. Gail's had these for 2 years. Trying to use cleaner shampoo and conditioners, however, thinks it's a skin disorder. Any thoughts on what it
Okay.
could be?
So scalp bumps, is it like flaky and dry, like skin layer bumps, or is it literally bumps from underneath the surface that are pushing out? That I have to know.
Okay.
Because that could
look
be
for
a
that.
buildup like psoriasis. That could be a psoriasis kind of buildup of tissue from too much inflammation running through your system. Your body will start making excess tissue. Or it could be bumps from underneath your scalp, and then that is going to be an inflammatory disorder, which I do not know which one you have because I don't have that in front of me. Um, but that's where I would start with this question. So hopefully we can get an answer here. I mean, you know, both of them. Let's just say psoriasis is also now categorized as an autoinflammatory disorder. So I don't know if you all know this, but we have autoimmune disorders, and now a whole new category has been created, which is called autoinflammatory disorders. And these are really on the rise. I mean, there is so much more psoriasis and eczema and skin conditions than we have seen in years past. I mean, like almost triple, you know. And the reason for that is that there is so much more inflammation. Don't freak out. Reality is there is more pollution in the air, and there is more pollution getting in through our skin, and it causes inflammation and toxins to get trapped in the skin layer, and it can't breathe, and it pushes out, or it inflames and starts attacking itself.
So Gail says that they're soft.
Okay.
And they sit on the surface of the scalp, if that helps.
They're soft on the surface, so there's no skin, there's no flaking or anything. They're soft and they sit on the surface. Okay. I mean, I'm wondering if you're getting some moles. We'd still be back to the lymph needs to move, because the only way we can change a mole is to get, moles come up like skin tags or, little skin growths, and people get them on their scalp a lot. But if you're starting to get more moles, then that usually means that, we are a river. So if somebody's getting moles on their arms, we're going to open up the armpit and the main drain, and we're going to make more room for that. If you're getting more skin conditions, no matter what it is, if you're getting more skin conditions that are up on the scalp or the top of your head, then we know that the lymph behind that occiput from the first question and in the neck and down to the chest, we know that this is probably not completely open. And, they call rasa, lymph, the rasa, the river of life. So it's a river. So you got to open downhill and get all of this draining, and then get this draining, and then you'd start going in with the gua sha, and you'd start seeing if that would drain more too. So things don't get pressurized up in the scalp, no matter what they are. They don't really kind of get stuck up there unless they're not draining through lower down in the body. So I really do think about salt scrubs, and I wouldn't do warming salt scrub even if it's winter. I would still do a cleansing salt scrub, because that's not cleansing your whole body, but it would be more cooling, more cleansing. So I do cleansing or cooling in your salt scrub. And I would be going in with that gua sha. And that's a really, really good reason to be doing that half a cup of aloe morning and night, because something is not draining or is inflammatory. And either one of those aloe would help. And then it also reminds me of just like, going back to the steam inhalations, and just like go under a steam tent with some rosemary leaves, and being willing to kind of get everything all warm, and then go in with your gua sha underneath your steam. I go to town under that towel.
Yeah. So good.
But I feel like that's a good place to start with that. And then you'd have to start tracking your immune system a little bit more. And if they really came up out of the blue and you're like, this is not answering my question yet, I would probably go back to tracking an allergen or an irritant food, like a food that you're eating too much of that, just is not necessarily working for you. So I would be thinking of that too. And remember, fire always rises when it's not moving down and out. So you got a week more to do intestinal cleanse and get that moving. Yeah.
All right. Well, this has been super fun. We had a lot of folks being here today with us, and it's so sweet to see you all. Thank you so much for showing up for yourself, for really digging in and being vulnerable. You were definitely treasured. Like us on Instagram. Check us out on YouTube. We've got a lot of really neat videos there. And keep an eye open on Instagram for that weekend giveaway to attend the My Body Mapping class. Remember, we are offering a free spot. So think of 3 friends that you think would really benefit from it. Think of yourself as potentially benefiting from it. And make sure that you follow us on Instagram, like the post, tag your friends, and at the end of the weekend, we'll see who the lucky person is. It should be you.
I want to do a shout out first off to Andrea and Jana Kruder, who have been completely changing my life and the DeAnna Center, and are just like the foundations of everything you see that is just changing like crazy on the website and the store and our representation. And it is just incredible. I have been crying actually for days because we launched a video. Jana made this incredible video. Andrea's in it. It's so cute.
With my blue hair.
It's
back
so
in the blue
good.
days.
But it's not just, oh, it's so cool. Check it out. Please. It's my life's work in a anthem. It's the most, listen to the words. It's like everything I believe in. It's everything I'm wanting to give to the world, what I'm wanting to represent in the world, and what I'm wanting everybody to come together and work on globally. And it's powerful. It's one of the most powerful things I've ever created with anyone. And I'm just really honored, and it's moving me. I keep watching it all the time. I'm obsessed. It's a minute and a half. Please go YouTube, DeAnna, My Body. And then now if you go to the website, there's My Body at the top.
Yep, I've got a link to it there.
And you just scroll on down.
About halfway
Please
down the
watch
page.
it. It's just, it's precious and it's real.
Yeah.
And it's people that you might even know because they're people from the center.
Yeah.
They're people who we've healed in clinics and panchakarmas and have come here for healing, and they're representing. And I just want to say thank you. You're representing also. But watch the video. It's really good.
It's so good.
Thank you.
All right. Thank you.
Bye. Adios.